All right, so I'm going to go ahead and get started. My name is Rebekah. I'm a physical therapist with React Physical Therapy at our Lakeshore East Clinic. Also on the call is Michelle Schultz. She is going to be kind of monitoring the chat function. So if anyone has any questions throughout, feel free to post something in the chat box, and we'll just monitor that and hopefully be able to answer that throughout the presentation. So we're located right across the Maggie Daley Park, so right downtown, and kind of near the Marianos. So we're both here at the Lakeshore East Clinic. So I'm gonna share my screen before I really get going. And make sure I'm still sharing my, Michelle, can you see me? Okay. So I just want to thank everyone for joining me today as I talk about urinary incontinence and pelvic organ prolapse. These are both conditions that I think a lot of, that it's not talked about often enough, or that women don't know enough about, or maybe don't feel comfortable talking about. So just want to make it clear that this is way more common than you think it is, but it does not mean that it's normal for these conditions to happen. It's just very common. So I hope everyone is ready to learn about these conditions and learn some things that are hopefully going to help you out. It can be a little confusing. There is a lot of information, especially if this is the first time with any exposure to the pelvic floor. So hopefully I'm able to keep this simple enough, but also give you enough information to take home and, hopefully make some changes throughout your day-to-day. So just a little bit more background on React Physical Therapy. If you have not already been a patient with us, we are a boutique style outpatient clinic with 6 clinics around the city and the northern suburbs. At React Physical Therapy, we focus on a whole body approach and stress one-on-one care with each of the patients. At the Lakeshore East Clinic, we have providers with an array of specialties. So we have vestibular therapy and women's health therapy, which I provide. And with each of us having a little bit of a different background, we emphasize a collaborative approach if we feel that a patient may benefit from another therapist's specialties. We are offering telehealth services as well as in-clinic services. So if you're interested in our services or ever want to refer someone over to the clinic, we can usually get you in pretty quickly. And in Illinois, we also have direct access, meaning that you do not need a prescription from your doctor prior to coming in for your evaluation. And then we also are offering complimentary injury screens. So if you're not sure if you would benefit from physical therapy, setting up a time to chat with one of the therapists without going through insurance is really helpful to make sure you're on the right path to recovery. So just a little bit more background on me. I've been treating in an outpatient setting for about 5 years. So I treat both orthopedic conditions, so low back pain, neck pain, knee pain. And then for 4 of those years, I've been treating women's health conditions. So I treat a range of from pregnancy, postpartum care, and any other condition basically throughout a woman's lifespan. The only thing I don't treat is lymphedema. And I wanted to give a little bit more background on pelvic health therapy, or also known as women's health therapy. So in physical therapy school, we briefly learn about the pelvic floor. So pelvic floor therapists go through additional and extensive training to learn and treat specific conditions women may experience. There are 2 tracks a pelvic health therapist may take. So there's an OB track and then a pelvic floor track. The OB track, they don't teach any internal pelvic floor work. That's something that you learn in the pelvic floor courses. I've taken courses in both tracks, so I do treat internally if it's indicated. Some other conditions that a pelvic health therapist may treat includes any form of urinary incontinence, fecal incontinence, pelvic pain, endometriosis, constipation, pelvic organ prolapse, and diastasis rectus, just to name a few. So the pelvic floor therapist will specialize using internal techniques to assess the pelvic floor muscles and to see how they're functioning. So it's similar when you go to your OB-GYN and they do an internal exam. Pelvic health therapists are trained to do that as well, except we're not looking at similar things necessarily. So we're looking at the strength of the muscles, quality of muscle contraction, coordination of the muscles. So if you can use the muscles at the right time, muscle tone, so if the muscles are tight, or your ability to relax the pelvic floor muscles. And then we use that information to treat specifically what it is that you're coming in for. It's not just Kegels the entire time, and I'll kind of go through that and explain why. But it's really making sure all of your pelvic floor muscles and the muscles surrounding your pelvis and the joints surrounding your pelvis are working together. So we're going to start off with a little bit of anatomy because I think it's helpful to understand what it is that I'm talking about and where these muscles are located. So often when someone mentions the core, people just think about the abdominal muscles. But really the core is made up of the abdominal muscles, the pelvic floor, the diaphragm, the glutes, the inner thighs. Pretty much all of the muscles surrounding the pelvis are important components of the core. The core is important in regulating what's called intra-abdominal pressure. Basically, that's the amount of pressure in the abdominal space. So kind of this space through here. So if you think of like a can of pop, when the pop can is not opened, there's a lot of pressure in there, and all the liquid stays in the can. If there's an increase in intra-abdominal pressure, so your throat closes, your pelvic floor is supposed to contract. If there's some weakness or failure or insufficiency of the muscles in your core, then this can lead to dysfunction or urinary leakage or some other type of pelvic floor issue. So there are four primary abdominal muscles. The rectus abdominis, which is over here, that's kind of that nice six-pack muscle that everyone strives for. The internal oblique, the external oblique, and the deepest muscle, the transversus abdominis. The abdominal muscles help to improve lumbopelvic stability and help control that intra-abdominal pressure. The abdominal muscles tend to be an area of weakness in a lot of women, especially if you are pregnant or you're postpartum or had a baby and never went through with rehab. And in general, I mean, abdominal muscles tend to be kind of just an area of weakness, just the nature of our society. We sit a lot, so those abdominal muscles tend to shut down, and so that can lead to an area of weakness. Another area of the core that we're going to discuss is the floor of the core, or the pelvic floor muscles. So the pelvic floor muscles are bowl-shaped, and they attach here at the front on the pubic bone, and then they attach towards the back on the tailbone, back through here. So it kind of loops around this way. So these are all pelvic floor muscles right through here. So there are actually three different layers of the muscles, and they function to support the pelvic organs, close the urinary and anal sphincters, provide postural support, and assist in sexual functioning. The pelvic floor muscles are always contracted, and they have a low level contraction. The only time that the pelvic floor muscles truly relax are when you're urinating, having a bowel movement, or giving birth. They typically have a stronger contraction when you have that increased intra-abdominal pressure. So when you cough or you sneeze, things like that. And just like any other muscle, the pelvic floor muscles are subject to becoming stretched out and weak. They can become overactive and tight, and then therefore weak, or they can become uncoordinated and not contract or relax when they're supposed to. I also just want to point out, so the other muscles in here, these are actually hip muscles. So there's a very close relationship of the hip functioning and how that affects the pelvic floor functioning, and vice versa. So the pelvic floor, how that's functioning will affect or can affect the hips as well. And this muscle in particular is actually attaches to the pelvic floor muscles just via fascia, which is connective tissue. And then lastly, in regard to anatomy, I just want to point out the normal positioning of the pelvic organs. So you have the bladder in the front, and then you have the uterus, and then the rectum back through here. And then women actually are more predisposed to urinary incontinence and pelvic organ prolapse because of this anatomy here. So if you can see right over here, there's a little extra space. That's an area of weakness in women that can predispose to that pelvic organ prolapse. So lucky us. All right, so urinary incontinence, what is it? It's the involuntary loss of urine. So if you experience even just a drop of urine, that would be considered urinary incontinence. There are multiple types of urinary incontinence, but the big three that I'm going to talk about is the stress urinary incontinence, urge incontinence, and mixed incontinence, which is just the combination of both the stress incontinence and urge urinary incontinence. And I do want to point out that this is not just something that happens if you have a baby. Women can experience urinary incontinence at any stage of their life, whether they have a baby or not, for various reasons. So, okay, so stress urinary incontinence is the loss of urine with effort or physical exertion. So this can be coughing, sneezing, laughing, running, jumping, heavy lifting. So with these activities, there's an increase in that intra-abdominal pressure. So again, normally with that increase in intra-abdominal pressure, that urinary sphincter should contract and close it down. Leakage will occur when there's an inability for that urinary sphincter to remain closed. And this can be due to pelvic floor dysfunction, abdominal weakness, or hormonal changes, or even a combination of the three. So pelvic floor dysfunction would include weakness of the muscles, tightness in the muscles, or difficulty with coordination of the pelvic floor muscles. If a muscle is tight, it usually has a hard time contracting effectively, and then it acts as if it's weak. So the tightness in the muscles can actually prevent the urinary sphincter from closing entirely too. Changes in estrogen levels is another reason that stress urinary incontinence can happen. And this is usually with women who are postmenopausal because there is a drop in estrogen. The pelvic floor muscles are actually driven by estrogen levels. And so when there's that drop, the muscles actually become or lose tone in the muscles. The other thing that happens, so the lining in the urethra over here is actually also driven by estrogen. The estrogen creates a sticky kind of membrane, and so the urethra kind of closes down on itself. When you have that drop in estrogen, that stickiness, there's less stickiness, and so it's easier for urine to come out. Urge urinary incontinence is the involuntary loss of urine associated with a strong urge to urinate. So sometimes that urge can be caused by a stimulus, like exposure to cold, running water, walking by a bathroom, or putting the key in the lock of a door. And this can develop for a few reasons as well. It's often associated with overactivity of the pelvic floor muscles, overactivity of the bladder, or habitual actions that develop over time. So for example, Most of us like to do that just in case peeing. So peeing before you go somewhere or you go for a drive, even if you don't really have to go, but either you don't know the next opportunity that you're going to be able to go to the bathroom, or maybe you don't like using public restrooms. A lot of us grew up practicing this too. Like your mom would probably tell you, hey, if you have to use the bathroom, just use it now. The problem with this though is when you go to the bathroom, when you don't really have to, it disrupts the brain and bladder connection. The bladder begins to signal a need to urinate before it has reached its full capacity. And eventually the bladder will signal the need to urinate at smaller and smaller amounts. And this can lead to urge urinary incontinence. Another example of the habitual cause is the strong urge to urinate when putting a key in the lock when you get home. Maybe you're consistently stuck in traffic, probably not right now because of COVID, but usually by the time you get home, you really have to go to the bathroom. So you put the key in the door, open the door, and then you sprint to the bathroom. Well, the more that this situation happens, the bladder begins to associate that strong urge to urinate every time you get home until it gets worse. And then you only have to see your door before you really get that strong urge. And then it just becomes harder and harder to make it to the bathroom in time. So really the cause of urinary incontinence can actually be somewhat complex on how it starts. There are a lot of underlying reasons that drive that pelvic floor dysfunction, or the abdominal weakness, or even the habitual causes. There are physical risk factors for developing stress urinary incontinence. So pregnancy and childbirth, if you had any trauma or tearing during childbirth, pelvic organ prolapse can also be a risk factor, which we'll talk more about pelvic organ prolapse in a few slides, but that you can actually have the leakage with that. Obesity, asthma, so chronic coughing, history of abdominal or pelvic surgery, so including a C-section or a hysterectomy, and then being postmenopausal. Some of the risk factors for urge urinary incontinence include those habitual reasons that we just went over. Overactive bladder syndrome, or even bladder irritants. Bladder irritants are things that irritate the lining of the bladder. Basically, the bladder then wants to flush that irritant out as quickly as possible. So a lot of people are probably familiar with that if they drink coffee or if they've, drink alcohol. You feel like you have to go more frequently. It's because it's a bladder irritant. Other things that are bladder irritants, caffeine, carbonated beverages, processed foods, acidic foods, and even concentrated urine can irritate the bladder lining. There are other reasons. This is not an exhaustive list of causes. So even if none of these are true to you, it just would be too much information to really list more than this. But these are the most common risk factors for urinary incontinence. So what can you do? So I'm going to go over just a few tips to help manage or prevent the urinary incontinence. A big thing would be keeping a schedule. Normal urinary frequency is every 2 to 4 hours, or about 8 times a day. So keeping a schedule can help identify if you're going too often or not often enough, which both can cause issues. So if you're going too frequently, your bladder is not able to stretch enough to hold the normal capacity of urine that it should be able to. And then this can lead to developing urinary urgency. This also ties in with the just in case peeing. A lot of women will start to do this because they also think that it's going to help with the stress urinary incontinence, which it may help to reduce the amount of leakage that happens, but most likely that leakage is going to persist. So it's just best to avoid that just in case urination. And then if you aren't urinating often enough, this can lead to overstretching of the bladder. And that can lead to stress incontinence or bladder infections, which then that can lead to the urge incontinence. It's also helpful to avoid the bladder irritants If you're not sure if this is an underlying cause of your urgency, I'd recommend keeping a food log and see if you notice a trend. Even things like oranges, tomatoes, or chocolate can be a bladder irritant. So if you notice that this is, if there is something that's contributing to some of your symptoms, you don't have to get rid of it entirely. If you can, if you want to. I personally would have a hard time giving up coffee, but sometimes you can dilute it by drinking more water. It sounds counterproductive, but it actually can be helpful. And then going along with that is just making sure you're not limiting your fluid intake. Drinking less water is not going to prevent you from experiencing any urinary leakage. It can actually make it worse by concentrating the urine, and so that's going to irritate the bladder lining. The NAC, so basically what that is, it's a contraction, a pelvic floor contraction or a Kegel right before coughing or sneezing or some sort of increased intra-abdominal pressure. So if you're jumping, doing a Kegel right before you do that action. If you feel sneeze coming on, you do the Kegel and then sneeze. It's kind of similar to the idea of crossing your legs, but it's just using your pelvic floor to actually do its job. Really, that's kind of the only time that I would recommend doing Kegels without having your pelvic floor evaluated. Again, this is because overactivity of the pelvic floor muscles can be a cause of urinary incontinence. And if that's the case, the Kegels can make your symptoms worse. So really, I would recommend physical therapy or to have your pelvic floor evaluated by a doctor as well to address it sooner than later to prevent it from getting worse. Pelvic organ prolapse is the descent of pelvic organs, so the bladder, the uterus, or the rectum in the pelvic bowl. So in this first picture here, this is a normal positioning of the organs. This part of the pelvis is the pelvic bowl. And so you can see in the picture here, the bladder is starting to move or kind of descend down into that pelvic bowl. Here, that uterus is coming down from that original position, and then same thing here in this picture with the rectum. The pelvic organ prolapse is usually due to a loss of tissue support, so both ligamentous support and pelvic floor strength as a result of excessive bearing down, either during childbirth or maybe you have a history of constipation or a chronic illness that causes you to have excessive coughing. It's not a life-threatening condition, but this can cause a woman to experience a range of symptoms. So pelvic pressure, heaviness, feeling like something's falling out. You can also have pain symptoms, so low back pain, urinary symptoms like I talked about with that stress incontinence, bowel symptoms, so you may have kind of similar to IBS symptoms, sexual symptoms as well, so pain with like intercourse are also common symptoms. The biggest risk factors for pelvic organ prolapse, the number of vaginal deliveries and instrument delivery. So if you had to have a forceps delivery or a vacuum delivery, that would increase the risk. Trauma to the pelvic floor muscles during childbirth. So again, if you tore, that disrupts the tissue support. Chronic constipation, IBS, a maternal history of pelvic organ prolapse. If you do a lot of heavy physical work, a lot of high impact exercise, being overweight, and then chronic illness that results in excessive coughing. So what can you do? The biggest thing is avoiding what's called a Valsalva maneuver. So excessive heavy bearing down or straining. So the straining increases the amount of stretch on the pelvic floor muscles, and this can lead to further loss of tissue support. So you can see in this picture, this woman, I don't know how much she's lifting, but she's lifting something heavy enough that she is closing her mouth. She probably is not breathing through her nose. She's probably bearing down with everything that she's got. And that is going to lead to that loss of the tissue support. So basically, if you remember to avoid the straining, a lot of the other tips that I go over should make sense. Preventing constipation or managing constipation symptoms is helpful to avoid that repetitive straining. So making sure you're drinking enough water. Maybe you need to increase your fiber or at least address your fiber intake. Exercising more, walking can be helpful. And then using a step stool to place your feet on when you're having a bowel movement. That actually helps to relax the pelvic floor so that you're not bearing down against a contracted pelvic floor. Because again, your pelvic floor should relax when you're having a bowel movement. Avoiding heavy lifting, prolonged standing, walking. As the day kind of progresses, gravity tends to take over, and that can make your symptoms worse. Weight loss is also beneficial. And then physical therapy, that has been found to be beneficial for mild to moderate prolapse symptoms. Unfortunately, therapy won't address the position of or won't change the position of the organ, but can help to reduce the symptoms that are associated with the prolapse and prevent it from progressing or getting worse. So mild to moderate pelvic organ prolapse, the pelvic organ is actually still in the body. Severe cases of prolapse would be that the organ is actually outside of the body. And typically that requires at least use of a pessary, which is an orthotic device, or sometimes surgery to really address that prolapsed organ. So I've somewhat mentioned throughout that I don't make recommendations for or against pelvic floor strengthening exercises or the Kegels. This is because I can't tell by looking at you or the entirety of your symptoms what your pelvic floor is actually doing. I don't know if your pelvic floor is just weak. I don't know if you're able to do a proper Kegel. I don't know if the pelvic floor muscles are tight, and trying to strengthen a tight muscle is just not going to be effective. Usually you have to loosen a tight muscle before you try to strengthen it. So my recommendation for the time being is to use the overflow principle, which is essentially just using surrounding muscles to activate the pelvic floor muscles and addressing other areas of weakness in your core. So these muscles include, and you don't have to remember the names, but these muscles include the obturator internus, the adductors, the transversus abdominis, and the gluteus maximus. So I'm going to show you 2 exercises to get started with. They're fairly easy to begin, just to really start activating the muscles. You may be past this, which would be fine to do other glute exercises or low-level abdominal exercises, but these are appropriate to do for both the stress incontinence and pelvic organ prolapse. Okay, so I'm going to just exit out of my screen so then you can see me. And so I'm going to get down onto the ground. And this first exercise, that's my phone. The ball escaped me. Okay, so the first one's very easy. It's just going to be activating those inner thigh muscles. So using either a ball, you can use a pillow, or it can use the Pilates ring if you have something like this. It's an easy way to just start firing those muscles. I like to start in a laying down position, but this is something that you can do while seated as well. So I'm going to just lay down here. The ball is going to go in between my knees, and I'm just going to squeeze. And I'm going to hold for about 10 seconds and repeat this 10 times. So a lot of times when someone has to really they have a strong urge to urinate. A lot of times you cross your legs. That's activating the inner thigh muscles. So same thing, it's part of that core. We want to try to strengthen here. Okay, so I'm going to just release in between. Okay, so just repeat 10 seconds, and then 10 repetitions. The other one, so still using this, or you can use a belt, or you can tie like a sheet around your legs. Just starting to use those glutes. So I'm going to put this around the outside of my knees, and then I'm just going to push out. So this I'm trying to activate my glutes, my hip abductors. I can add in a bridge with this too to further activate my glutes. Okay? And then come back down. If I want to keep it pretty simple, all I have to do is just push out, hold for 10 seconds, and do 10 repetitions. Or again, if I'm kind of past that, I can add in push out, bridge up. Okay. And this I would probably do about 2 to 3 sets of 10 repetitions. And again, I can do that. I can do both of those in a seated position. If laying down is a little bit too easy, I can start there. And there's definitely other ways to strengthen those muscles, but those are pretty easy, kind of basic ones to get started. You don't need a whole lot to get going with that. Okay, so I'm gonna just, I have I think 1 or 2 more slides, and I'm just gonna finish with, and then we'll have time for exercises, or questions. Okay, so how can pelvic floor therapy help? So PT starts off with an evaluation and assessment that identifies your specific muscle imbalances. So during an evaluation, we start off by discussing the symptoms that you're experiencing, your history, your goals for therapy, and then we look at the whole body. Depending on your comfort level, a pelvic floor assessment can be done the first day, or if you feel like you need a little bit more time, it can be performed at a later time. The evaluation and treatment is performed in a private treatment room, so there is plenty of privacy. You don't have to feel embarrassed about anything. And then the treatment is based off of the findings during the evaluation. So the focus for you may be more on muscle relaxation for the pelvic floor, or strengthening for the pelvic floor, or both. But it is specific to you. It's not just a cookie cutter strengthening routine that you find online that could possibly make your symptoms worse. Same thing with like the lifestyle modifications, recommendations, they are specific to you. The patterns that you find throughout the day, you know, we can make suggestions and modifications based off of that. So I'm going to leave the rest of the time to allow for any questions that you may have about urinary incontinence, pelvic organ prolapse, or in general about the pelvic floor or pelvic floor therapy. This is my contact information, so if you have any other specific questions, then feel free to reach out. I know this was a lot of information, but hopefully you're able to take away a few key things that you might be, to help you with things that you're experiencing. And I believe that this presentation will be posted online if you go to React Physical Therapy's website under like a webinar or events tab, I believe. It should be posted. And I'm always, again, available either by email or phone call. So I'm going to exit this screen. There are a couple of questions. So let's see. Okay. Oh, there's one in the Q&A. Okay, so for the first one I see, does a collapsed bladder cause urinary incontinence? Collapsed bladder. So yeah, so any issue with the bladder itself can be a cause of urinary incontinence. So if there's not enough stretch in that bladder, so the bladder is a muscle, so it has to be able to stretch and it has to be able to contract. So if the bladder is collapsed, at least this is my understanding of the question, if there's not enough space for it to expand, it can lead to issues of like urinary retention, and urinary retention can lead to urinary incontinence too. So it's possible, definitely. Let me look at, okay, so there's two questions here. So is pelvic floor prolapse diagnosed by a physical exam, or is there a test like a CT required? So the pelvic floor prolapse is diagnosed with a physical exam. So often a woman is asked to bear down as strongly as she can, and then the physician or the therapist will look to see if there's anything kind of coming at them in that vaginal canal, which is typically where we'll see it. Let's see. A lot of issues with pain in my pelvic floor while biking. Okay, so I've had a lot of issues with pain in my pelvic floor while biking. Are there some exercises I can do before riding to help loosen it? So that might be also an issue of the bike, the seat on the bike. Sometimes if the bike seat is too narrow, that can actually kind of pinch on the pelvic floor nerve. That can cause pain. But otherwise, if you do, like for example, this might be beneficial, doing like a butterfly stretch. So if I come into this position, sometimes that can be helpful to relax the pelvic floor while you're like to do before you're riding. The other thing I would be aware of is doing some hip strength or stretching. So maybe doing like a little bit of a piriformis stretch. That'll help to stretch the piriformis, which is very close to the pelvic floor, and then also the obturator intermus muscle. I would probably start there. Check to see if your bike seat is too narrow as well, and see if that maybe, you know, using a new seat is helpful. Okay. So this one, let's see. So I'm 20 weeks pregnant and it feels like I need to pee when I run. No incontinence, just urge. Should I stop running when that happens? I guess that would depend on how far you get when you're running. Like if you're, you know, running 10 miles and you're starting to get that urge, then maybe just cut back on your mileage. The other thing would be just to make sure, I mean, when you're pregnant, it's kind of tough just because as your belly grows, that pressure from your uterus and the baby is gonna, more when you start running. Okay. You might be getting into a little bit of like a habit then. Make sure, I would look to see first if you're having any of those bladder irritants before, making sure you're staying hydrated before, because that can cause, some people start to limit their amount of water before running just because they feel like they're gonna have to pee throughout. That can be helpful. The other thing that might be helpful is using a belt to kind of take some of that weight of your belly off of your bladder too. Try that. You don't want it to develop into that habitual cause of urgency. So if you're not able to help with that with the belt or the bladder irritant, you might want to consider trying something else. The other thing you can actually try, so similar to the nap, would be doing a couple repeated Kegels in a row. Sometimes that tells the bladder just to quiet down a little bit and calm down. I would start there before you totally stop, but see if you need to modify that. Yeah, you're welcome. Let's see. Can physical therapy help with pelvic prolapse caused by a drop in hormones? So if there's a drop in the estrogen, you may require estrogen therapy, but physical therapy definitely will help on top of that. But you may need a little bit more with that estrogen therapy, which you would want to discuss with your physician. Any other questions? Good questions. And again, I'm definitely available via email or phone call if you don't have any kind of immediate question. It was kind of a lot of information to take in, and it's so specific that sometimes you have to think about everything. To help prevent prolapse, will it help to keep the tummy tight when exercising? You mentioned not to bear down. Yes. So that is actually huge when exercising. So using your abdominal muscles, having your core engaged, or sorry, I shouldn't say core, but having your abdominal muscles engaged will help to support that pelvic floor so that you're not bearing down. Yeah, definitely if you can, try to keep that tummy tight. Let's see, would I recommend pelvic floor therapy during or after pregnancy or both? I would hands down recommend it for both. During therapy that can help, during pregnancy that can help to, one, provide more education on preventing tearing and really strengthening your pelvic floor beforehand, and just the abdominal muscles, the hip muscles, kind of helps prepare you for delivery. And then after pregnancy, even if you're not experiencing any pelvic floor issues necessarily, I think it's helpful to rehab yourself, make sure your muscles are working properly, making sure your abs are turned on, your pelvic floor is doing what it needs to do to help prevent any issues in the future. So yes, definitely both. You're welcome. Any other questions? Give you like another minute or so. Okay, I think that might be it on the questions. So I just want to thank everyone for tuning in. I think it's super helpful to at least have some exposure to the diagnoses and the learning about the pelvic floor. It's an area that's definitely not talked about enough, but I definitely recommend talking about it more, asking your friends or your mom or whoever, your aunt, about their experiences. Just especially that you're not alone in this. And if you have any other questions, feel free to email me or call if you need. All right, so I'm going to go ahead and end the chat. And it was great presenting for you guys. Bye.